Welcome to the village. Today my guest co-host is LP. How are you?
I'm good. How are you doing?
Good. So nice to see you again.
I know. Same here.
Yeah. So you're in a bit of a break now from a really hectic schedule lately.
Yeah.
Tell everybody what you do.
Okay. Well, my name's LP. I am a pediatric hospitalist, meaning I'm a pediatrician who only works inside a children's hospital, taking care of children who are ill enough to be admitted to the hospital for care. We initially, when COVID hit, weren't seeing very many acute cases of COVID-19 in children, which was a blessing. Unfortunately, with the reduction in mask mandates and in people getting out and socializing in mass more, we're seeing a rapid increase in the rate of cases. And this Delta variant is turning out to be much more severe as far as the symptoms that it causes. We're also seeing more acute cases, meaning children who have symptoms early on. Previously, we were seeing children who had a condition called multi-system inflammatory syndrome in children. So it was kids who had been exposed to COVID-19 later on, developed a systemic response that they would get pretty sick with, but we weren't seeing a ton of them. Now we're seeing kids who come in with acute COVID infection, meaning they have a lot of respiratory symptoms. Some of them get so ill that they end up in our intensive care unit requiring intubation, meaning a tube down the throat, and being on ventilators to help them breathe. Early on in the pandemic, we had just a few rooms where we had designated for our children who have COVID infection. Now one of our entire floors is designated to children who have COVID-19 and aren't sick enough to be in the intensive care unit. Our intensive care unit has had to expand their COVID unit as well because of the increase in cases. So it's pretty frightening right now.
Yeah, and like you said, last year when there was the heightened COVID cases in more like adults, and that was 2020, but now 2021, we're seeing a lot in children's. Like you had said, it's the mask mandates, and would you say like vaccines, or is it more like social distancing? What's causing, and why children? Is it just the fact of the variant, or is it more aggressive towards children's physiology, or is it because children are left to be infected that weren't infected? Why do you think more children now?
That's a great question, and I think it's multifactorial. So it's a combination of everything that you listed. We've reduced social distancing. We've reduced mask mandates. Some places are refusing to have them. Some places it's optional. In some places, even though it's a mandate in place, they're not really enforcing it. You have people who aren't getting vaccinated, so you're not able to allow herd immunity to take effect. So you're still seeing breakthrough cases in those people who are vaccinated. And then you have the Delta variant being much more transmissible. So more people are getting infected, including children. And by default, you're going to see more cases of people who get sick enough to be admitted to the hospital and or severely ill enough to end up in an intensive care unit. The reason that's so frightening is there's only so much any hospital can do as far as resources. At some point, the resources get overwhelmed. Our hospital has been full and over capacity for months now.
It's been months.
Yeah. And when we're over capacity, that means people are just waiting down in the emergency department, or people aren't able to be seen in a timely fashion. So they're getting sicker before they get the medical care that they need. At one point, we've had to divert people to different facilities, either in our state or in a different state. And that's what's most concerning is with the rise in cases, you will overwhelm resources. We saw that in the adult world. We're seeing it for the first time in pediatrics. We're still seeing it in the adult world with this uptick in cases related to the Delta variant and all of the other things that we mentioned.
Yeah, and that's scary because the children that are getting infected with COVID and in ICUs, and they're intubated, right? So they're on breathing tubes and breathing machines, and they weren't previously sick. Like, these are healthy kids that just happened to get sicker.
Yes, I think there's been some misleading information, misinformation, disinformation, whatever you want to call it. I'm saying that all the people who are getting sick, it's just because they had underlying conditions. And that's not true for everyone, particularly young children. We are seeing a big impact on our children who have obesity and no other known conditions, so no high blood pressure, no diabetes, no anything. So we do see some risk related to obesity. However, we're also seeing children who had nothing at all before, and after they recover from COVID, they still don't have any underlying disease that has been recognized or diagnosed. And that's particularly worrisome. I do want to make sure I don't have people under the impression that I think that children are more susceptible to this particular variant, because that's not the case. We're seeing a rise equivalent to the percent that they had before. It's just a faster, larger group because so many more people are getting infected this time around, both on the adult side and pediatric side.
So the thing with the Delta variant, like many of these variants, is just the virus becomes smarter in how to actually transmit itself. Not that the virus itself is more deadly in the sense that it doesn't have ways to make us sicker. It's just a fact of how more people are infected.
At first, we thought it was just because of the amount of people getting infected, but there is some concern rising that, yes, the Delta variant may actually cause more severe symptoms. There's still not enough data for us to confirm that, but the fact that we're seeing such a rapid rise of people ill enough to be in the hospitals, to the point that it's overwhelming medical resources again, does suggest that this particular variant likely can cause more severe symptoms than the previous variant. So I think what I always want to take away is, what can we do to protect ourselves? Mm-hmm. And you have the personal choice. Everyone has their personal choice to get vaccinated or not. They have their personal choice to wear a mask or not. The most effective thing that we've seen to help reduce the transmission is wearing a mask. That has been confirmed. Everybody's aware that that is helpful in reducing the number of cases. By reducing the number of cases, you reduce the number of people who get sick enough to be in the hospital. You reduce the likelihood that medical resources get overwhelmed. So it's a pretty simple thing to do. Sometimes you have to weigh the benefits to many over the benefits of one. And in this case, and particularly when you're in the middle of a pandemic, because you have the potential to save lives just by wearing a mask, I think it would be beneficial for you to wear a mask. Again, you can choose, but mask wearing is definitely something that I can recommend to help protect yourself. Vaccination. Vaccination is proven to decrease the likelihood you'll get the disease. It's also proven to decrease the likelihood that you'll get as sick as you would have gotten if you didn't have the vaccine. So vaccination is another way that you can help protect yourselves. Being smart about getting out and socializing, wearing your mask if you are going to be out in a crowd, minimizing taking off your mask, and minimizing your closeness to people. So they had previously reduced from 6 feet to 3 feet. I think it would be beneficial for us to start getting back to where we're doing better at social distancing even further and going back to the 6 feet distance. And just making sure that you're following whatever mandates and CDC recommendations are coming out, the mandates in your state, in your city, your county, and then following closely with what CDC is recommending.
And that's just cdc.gov people can go to. Yes. There's a lot of COVID information on there. With the masking, obviously when people are wearing a medical mask, it's basically you're reducing these particles. That's how masks work. If you're walking around breathing freely in the air, you're spreading whatever you're breathing out, and you're breathing in whatever people. And in essence, that's what the virus wants, because the virus wants to keep reproducing itself. So it wants to keep invading bodies. And if we wear a mask, it's kind of like a shield, like on a battlefield, correct? So that's like a good way to describe it in my mind, where there's shielding and kind of trying to ward off the virus from entering bodies, because if it doesn't enter, it can't reproduce of itself, and then it won't be able to continue surviving, basically infecting people.
Right. And in addition to shielding yourself, you're giving the gift to many. You can protect your family, you can protect your friends, you can protect someone you may not know very well. That is an amazing gift, and it's by doing something as simple as wearing a mask.
Yeah, I guess what he was said, wearing a mask, people talk about constitutional rights, but wearing a mask and getting a vaccine as being patriotic, right? Because you're thinking about the rest of your country.
Yes. Definitely. I would consider that very patriotic to focus on the good of many in our nation and trying to keep everyone as safe as possible. In a time of life-changing events in the health field, socially, environmentally, and doing something as simple as wearing a mask can really, truly save lives.
Yeah, absolutely. And the question is, the children that are getting sick, have you noticed or are you aware of whether their parents are vaccinated, or does that really make a difference towards the children getting sick?
So we are seeing some instances of parents who are vaccinated and their children have cases. We've seen an increase of that since schools have opened up, particularly in the schools that do not require a mask. We've seen an uptick in the cases of breakthrough COVID-19 infection in families of vaccinated parents. In a perfect world, we'd already have the ability to vaccinate our children, but we don't at this moment in time, which is why it's so important for us to really think about the safety of children and how we can help keep them safe. One is by getting everybody who can get a vaccine vaccinated. The other way is by continuing mask mandates in schools, not making it elective, making it a requirement like we did in the past. A part of why we didn't see an uptick in children was because we did such a great job of social distancing, wearing masks, virtual school when we were right in the midst of the pandemic. Now we do know that it's important for children to socialize, get back to school. We can still do that safely simply by wearing masks.
With the concept of herd immunity that you mentioned, I think that goes a long way with protecting the children who cannot get vaccinated, because even the studies that are being done, it's still limited to 2 years or older. So we still have a population that we will have to protect through herd immunity. Do you want to just talk a little bit about what herd immunity means?
Yes. Herd immunity is the concept of by vaccinating many people, and you'll hear different people say different percentages, but typically if you're at 85 to 90% or higher on vaccination, you have better herd immunity. The higher the percentage of people who are vaccinated, the more effective the vaccines will be, the fewer cases that you'll see. Right now, depending on your city, your county, your state, we're seeing as low as in the 30s to 40% vaccinated in certain areas of the people who are eligible. And that's really disappointing, particularly since so many people have gotten vaccinated. There have been so many tests and evaluations and studies to see what the side effects are and whether this vaccine is safe. And it has proven to be very safe for people. A lot of the fear that was previously out about how rapidly they produced the vaccine was based on the fact that people weren't processing the fact that the ability to create vaccines has rapidly improved because of proven studies that have been successful in creating similar virus type vaccines in the past. So the vaccines that are in circulation are very safe. We are seeing that we're likely going to need boosters. So at some point, that's something else that we'll do. However, we still just want to get as many people as possible to get at least one dose, if not the 2 full doses, so that we can ramp up that herd immunity as soon as possible.
Right, absolutely. This kind of genetic vaccination technology with like recombinant DNA and RNA, that's already been used for other vaccines. And like you said, vaccine technology has come such a long way since the days of the Spanish flu, for example.
Right.
And it's always been vaccines that have saved the day.
Mm-hmm.
There's not much else of a way, smallpox, polio. So that's our solution.
Right.
Because we have like variants, they come about because that's just what viruses do. They mutate. They'll mutate and mutate themselves again and again, and sometimes their mutations make them stronger and more deadly for us. Mm-hmm. Because until we can get rid of them with herd immunity, they'll just keep basically infecting us.
And I'm glad you mentioned the influenza pandemic of 1918. Unfortunately, what I'm seeing is a lot of history repeating itself. Mm-hmm. They learned during that pandemic that wearing a mask was protecting people. One city in particular stands out. San Francisco did do a mask mandate, had it in place for at least a month. They didn't see very many cases. And as soon as they relaxed the mandate, they started to see a rise in the cases. Well, once they relaxed the mandate, people didn't want to put the mask back on, and you still saw just rapid increase in cases. And I feel like that's exactly what we're seeing now. We know that this is an effective way to reduce transmission of viruses, wearing masks. We know that that helped us to decrease the number of cases that we had early on in the pandemic. Despite knowing that, we've relaxed the mask mandates periodically throughout the pandemic, and we've repeatedly see surges after we're relaxing the mandates. Until we're better and more consistent at wearing masks, we're going to continue to see this issue. We are going to have to continue to try to come up with other ways to protect ourselves, like the vaccines, getting people vaccinated, making sure that we have vaccines available worldwide and not just in more developed countries. But what we do know is we have masks available right now.
Yeah.
Fabric masks, medical grade masks, whatever it is. As long as it's a covering over your face, it's helpful. So wear them, please.
Yes, and and this is coming from a pediatric hospitalist whose your whole life has basically become COVID all day, every day. I mean, it must be so demoralizing, stressful, emotional for you.
It is, and it gets extremely frustrating and disheartening when we have a medical issue become politically polarized. There's no good headway in actual development and progression of scientifically proven beneficial methods of protecting ourselves when it's been decided that this political party is in line with masks and this political party isn't, and they just refuse to bend on the issue. That is counterproductive and very, very frustrating that our nation is allowing politics to drive something that is so vital to helping us save lives.
I guess that just speaks to like such an unhealthy environment and world that we live in, not just physically, but socially, emotionally. It's the point of togetherness and helping each other, and humanitarianism gets blocked so many times. And I think the reason we go into this field is to help people to educate and guide and keep our children healthy is what we do. Like, I try to do the preventive angle, and of course you do the very sick children. Working at Children's Hospital, you see the sickest kids around, and for the hope that if someday, we didn't think about pandemics and such when we went to medical school, but they seem to come about pretty often in the grand scheme of things. So you would think that that's when your medical professionals can be your guiding light, and to then have us kind of pushed into like this mix where people are so confused because they don't listen and they're instead having fears and mistrust. Your medical professional is the person you should trust, and instead there's so much mistrust around it that I feel like our voices are being drowned.
Right. And I think that goes both ways. I can understand why there's some amount of mistrust with the medical community, because early on there was some misinformation being given about the pandemic, more along the lines of we just didn't know enough yet, but we're coming up with these policies, recommendations, kind of on the fly, because our administration at that time disbanded the pandemic committee that would have been already prepped, studied, had a plan in place. So that did lead to a lot of medical misinformation given out at the beginning that I think did kind of leave some people questioning the accuracy of the information that was coming from the medical community. However, we have taken great leaps and bounds to correct that and provide as accurate information as possible, and have been pretty consistent on certain topics such as wearing your mask, such as the benefits of getting vaccinated, such as the safety of the vaccines. And despite that, I think that initial misinformation has left some people still skeptical. How do we counter that? We counter that by continuing to say the same thing and being consistent in our message, continuing to focus on the fact that when it's all said and done, I truly believe all humans are innately good. Unfortunately, like my dad always said, the masses are asses. So when a lot of people get together and are polarized, not a lot of progress gets made. When that happens, we have to take a step back and think about common sense. What is going to help me? What is going to help those I love? What is going to help the people that I'm around and I want to protect? And something as fundamental and simple as wearing a mask will do that. Something as fundamental and simple as getting vaccinated will do that. Those are things that we can do at any point to help each other. So I encourage people to take those steps to try to protect your families, your friends, your neighbors, the person who delivers your mail. All of these people are vital to you. Even though you don't meet them every day, you don't see them, anyone is vital to you. The people who work in our sewage companies, they're vital to us. If your trash wasn't getting picked up for months or weeks or whatever, you would realize how vital everyone is to you when stuff like that happens. The bottom line is the more people we lose in certain fields because of illness or because they no longer want to do that field because they're scared of whether they'll get the vaccine. So we've seen a lot of people no longer work in hospitality. We've seen a lot of people peel back from restaurants. We're seeing nurses peel away from working in hospitals and clinics because of the fear of getting COVID-19. And every time we lose someone in these fields, we're getting more and more reduction in our ability to have the daily lives that we want to go back to. So again, wear your mask, try to protect each other so that you can get back to the life that you lived prior to the pandemic.
Right, which is a life where, like you had said, we all depend on each other. We're a society. So yes, it's an individual choice, but you are a part of society. So if it would benefit society to get a vaccine and definitely wear your mask, then just do it for the greater good. Now, what about with the children? This past week was like such a crazy week. It was back to school week and me doing outpatient. There's kids going back to school and the decision about getting 12 and older vaccinated, and then parents already thinking about the decision for age 2 to 12 getting vaccinated, what to do. And, I'm absolutely for it. Like we just discussed, like the evidence shows, and they'll have enough research, they'll have enough data, they'll have enough proof, and they'll go through all the due phases and all the due safety trials. So before they start injecting children, it will be safe to do so. My take on it too is protecting children with the vaccine in my office are not protecting them, and then they end up in your hospital. So parents are very worried, injecting your child with something, putting something foreign in their body, of course, is going to scare you. But I like to think about what the side effects of COVID are versus the vaccine. So all of us are at risk for COVID. All of us could get COVID. We could all get sick with the virus. So it's not that if you're careful enough, yes, if you're careful enough, that decreases the chance, but the chance is getting higher every day with these variants. With the vaccine, what we would like is a world where there's no COVID. Since there's no vaccine, there's no illness with COVID, but we don't. So we don't have that choice to not do anything. We have to do something. So to me, the vaccine versus getting sick with COVID, what are your thoughts on the vaccine? What would your recommendations be to families?
My recommendation to families is, number one, think about the risk and benefits. And the best way to get the information about the risk and benefits of the vaccine versus the risk and benefits of COVID-19 are to research websites that have proven to be reliable, such as cdc.gov, on information about COVID and how to protect yourself, vaccine safety. Most city and county health departments also have fairly reliable information on websites. The things to avoid: Google searches, going to .com sites that aren't as policed and regulated, getting your information from social media. Because it's posted on social media does not mean it's accurate. There is a ton of misinformation and disinformation on social media platforms. So it's important not to use that as a reliable source of information. It is a source of information. It doesn't make it a reliable source of information. Do your due diligence like you do everything you do when you make the decision about having children, you weigh pros and cons of that. When you make decisions about what to do now that you've had your children, how you're going to raise them, what you want to focus in on, how you want to support them financially, you take your time to make those decisions based on as much reliable information as you can gather. So that's the number one thing to do, is gather reliable information. Talk to your healthcare provider. Hopefully this is someone that you've established a relationship with, because it's extremely important for children to go annually at least to see a doctor to make sure that you're catching medical conditions in them that might otherwise go unchecked, making sure that you're checking issues with their development that might otherwise go unchecked, and then can talk about issues like how to protect their child during the pandemic. So in addition to getting the information that you can from as reliable sources as you can, talk to your healthcare provider once you have that information. Allow them to talk to you, explain why they think it's good to have the vaccine, what the risks are for the vaccine, and what the risks are with COVID-19. And then use that information to make the decision that's best for your family. I will say I do highly recommend everyone who can get a vaccine, because you want to be able to protect your family. That means your children, yourselves, your grandparents, your parents. Everyone can be protected by wearing your mask and getting vaccinated. I do still believe it is a personal choice. I hope that the majority of people will make the choice to protect as many people as possible by getting vaccinated and wearing masks.
Absolutely. I'm glad you explained it to people. Is there anything else you think people should know that you've seen or that you would recommend, or just comment on like the state of COVID and the pandemic and the lockdowns and what this has been doing and where do we go from here?
I think that we're going to have to make some hard choices. I know everyone wants to get back to life as it was prior to the pandemic. The fastest, most effective way for us to do that is to really buckle down on social distancing, wearing masks, getting vaccinated. The sooner we do that en masse and unite as a nation, the sooner we can beat this pandemic. Until we do that, we're going to still see these periods where we're doing better, numbers go down, and then we relax everything and surges go back up. What's frustrating for me right now is, in addition to dealing with the rising numbers of COVID cases, we're also dealing with a pandemic related to other viruses that typically affect children, one of which is respiratory syncytial virus. We typically see those cases more in your fall and winter months. We've seen respiratory syncytial virus, or RSV, cases throughout the entire summer, and as many children, if not more children, who have COVID have RSV in our hospital. The combination of both of those things happening at the same time have led to the issues we've had where medical resources are being overwhelmed. Our hospital is staying full. We're having to divert children to other facilities because we just cannot take care of them in our facility. Those are issues that are happening not just in one state, but throughout the nation, throughout the world, probably are seeing some issues. We need to do a better job of staying focused as a nation to help ourselves, help those we love, help our neighbors, help everyone that we can to get to a point where we can get back to the lives that we led prior to the pandemic.
This back to school situation, I just wanted to comment and see if you had anything to kind of add to this. Now that we're getting back to school, usually back to school pre-pandemic was a time where kids got together, they got sick, they got their strep throats, and they got the flus, and they got the upper respiratory illnesses. There's a lot of illness. That's where kids would build their immunity, daycare, school, and what have you. And now there's a kind of like a chaotic situation, and going forward in the next few weeks, I'm really going to have to get together with my colleagues and really figure out the best way to make this transition as less chaotic as possible, because many children can't get vaccinated. They have to wear their mask in school. They're not always able to sit the 3 to 6 feet apart, depending on if they're doing the 3 or the 6. Some of the schools are having them wear the mask all day, and then they're getting headaches from that, or they're not getting breaks, and then parents want exemptions. And us as individual providers cannot make exemptions if that's where the state mandates. Like, that's a law that we can't make those decisions for, but we can do the best we can with whatever we can recommend to the school. Like, I like to advise the principals, if I can, to allow kids to take their mask off outside, like maybe go in groups where they're 6 feet apart and take their mask off for breaks, because it is hard for children to have a mask on for an 8-hour school day. But on the other hand, if you don't wear the mask well enough or efficiently enough, we're going to go back to being at home because kids are going to get sick, schools are going to shut down. Even if kids get their routine viruses, they'll be sent for a COVID test, and then they may be positive, they may be negative, but really just keeping those masks on in school. And I think school is the best place for the children to be, because prior to that, they're not learning as well. Their socializing is going down the drain. So it's like we keep getting back into this vicious cycle. And so we have to think about our children and our schools until the vaccines are approved for them. Then we need to have the conversation about getting children vaccinated.
Mm-hmm. Those are all good points. One of the things I think is important to helping children better be able to wear masks the entire school day comfortably, to make sure your child has a properly fitted mask. Many of the instances of these headaches are inappropriately tight masks that put pressure on temples. So just making sure that you have your child in an appropriately fitted mask is helpful. And also educating your children about the benefits of it and why it's important for them to wear it helps. Depending on how you frame things, if you say, yeah, I know it's going to be hard for you to wear your mask, it's more likely that it's going to be hard for them to wear their mask. If you tell them you're going to have to wear your mask because this can help keep you and your friends safe, they're going to be more likely to wear their mask. So it's all about how you frame it as well. I say that because every child in our family has the ability to wear their mask, and some of them are as young as 3 years old and wear the mask comfortably throughout the entire day. And that's because it's framed as this is something that you're going to have to do to help keep yourself safe. And that conversation is helpful, and it allows them to understand the importance of it and how what they're doing can help the ones around them stay protected. So it's also important about how you frame the mask wearing process. Many of the times, in life in general, if you frame things in a way that has any amount of negative connotation to it, people are going to be resistant to it. Same thing applies to something as basic as mask wearing.
That's such a great point. And as parents, being a good role model by wearing your mask and being as positive as you can about it, your child will feed off of that.
Mm-hmm. Yes.
Anything else that you think is important for parents or families or our society to know or to think about?
I think it's important for us to remember that when it's all said and done, we're all in this together because we're all going through it. It's not unique to you. It's not unique to me. Everyone has had potential exposure to it. Everyone has had stories of people they knew, or family members who know someone who've either had COVID-19 or had to go into quarantine due to concern that they were exposed to COVID-19. This is affecting everyone. Nobody lives in a bubble. All of this is affecting each and every one of us in some way, shape, or form. The longer we stay in this, the more we're going to have issues with mental illness. We've seen an increase in that. Mm-hmm. We've seen a decrease in children's ability to socialize because we've had to do social distancing. We've seen issues with the environment because there are periods where CO2 production rapidly decreased because people aren't going anywhere. And then we relax mandates and people are out and about and those CO2 levels rise, and that's affected our climate. We just need to get back to where we're more consistent, and the fastest way to do that is to take steps to try to reduce the spread of COVID-19. And again, the things that we have available to us to help do that right now are wearing masks and getting vaccinated.
Absolutely. Well, thank you so much.
You're very welcome. I enjoyed our talk.
Yes, I did too, and I'm sure everybody will come away with a lot of good information.
Yeah.
Yeah.